coming to my house. It's actually a lot of fun because you get here and I've got llamas outside that will greet you.
Well, we have a little zoo. We got some cows and dogs and cats.
Hi, Pikachu. And I also have a lot of birds.
We got all kind of animals.
Hi, Mocha.
And we love them.
And I have a lot of collections of antiques. Not because of me, but because of my husband. Yeah.
It's a museum. Majority of the stuff, it's in antique shops, swap meets.
So I have 4 children. 3 of them are girls, and then I have my baby boy, my son. And my 3 girls, they're all different. I mean, they're all different. But they're all so sweet, and they're all so loving, and they're all so much fun. So they keep me on my toes every single day. So a quinceañera is when a little girl turns into a young lady. Hispanics feel like from 14 to 15, once the girl turns 15, she becomes a young lady. Anytime it's a quinceañera, it's a big 15 party. This January was it was so bittersweet because I was like, oh, she's so beautiful, she's gonna turn 15. But at the same time, I was like, but she's my last one. She's my last quinceañera. I was so happy because I had actually seen all 3 of my girls grow up to make it to their 15, and I'm still standing strong, and I'm still able to help them, put on their dresses or to help them whatever that they need, what I thought I wasn't gonna get to do. I thought that I wasn't gonna be able to do that. My name is Nancy, and I have multiple sclerosis. I just thought that losing my balance was just part of the symptoms of just me being tired or, something off. I just didn't think nothing of it. And so when they diagnosed me with MS, it was a big deal.
Multiple sclerosis, in its most basic terms, it is a disease that affects the central nervous system, in particular the brain, spinal cord, and it can also include the optic nerves. That's the central nervous system. In neurology, MS, multiple sclerosis, is one of the most commonly diagnosed conditions. It is autoimmune. One of the ways to think about autoimmune is that we all depend on our immune system. Those are the cells that fight for us against infection and so many other things. For some reason, that immune system can be perhaps a little confused at a certain time, and it can get triggered in a way that it can attack our brain, our spinal cord, or our optic nerves.
I was in denial, like I didn't want to accept it. I had already seen what had happened to my brother and how he had already lost all of his mobility. So when I asked my brother about these symptoms, I said, did you have the same symptoms where you would lose your balance or you couldn't feel your hands? And he just looked at me, he was like, and that was that.
How does MS affect the Hispanic population versus other ethnic groups with regards to the symptoms and the symptom onset? So over the years, those of us who treat and diagnose MS in the population of Hispanics, Latinos in the United States and abroad as well, have come to see certain patterns. One of those patterns tends to be the sensory and weakness associated together. Some of our patients have actually had something that is called transverse myelitis, which all it means is that the spinal cord is one of the first areas that might be affected. And when that happens, there's the typical pattern of tingling numbness that starts in the feet, slowly ascends up to the knees or the waist or to to a higher level, and that's associated with weakness. There's also a very high prevalence of optic neuritis as well. And so vision loss in an eye that then progresses from one day to the next.
Once I was diagnosed and they told me that I had multiple sclerosis, I had an issue where I couldn't feel my hand. My vision was blurry on my right side. All I could think of after the diagnosis was, how am I gonna do my daughter's hair? How am I gonna move ahead with doing anything with my kids if I'm already with these symptoms? I had these symptoms that I didn't know what the future was gonna hold. So it's been a roller coaster with my medications. When I get relapses, sometimes I'll start with really, really bad headaches. I'll be walking, and if the wind is blowing super hard, like these last couple of days, I'll lose my balance just with the wind.
Well, I told Nancy, I say, it's gonna be okay. God is good. God is good all the time. And every time that she was telling me, like, hey, I feel like I'm dizzy, or I feel like I'm losing my balance, all this time I always tell her, you're healthy, you're perfect. But other than that, I'm always let her know that what she has, it's not going to take over her life.
I was so worried because I had already had my 3 daughters, and all I could see was my brother being in bed, bedridden. At this point, my parents were already caring for him, where they would feed him and they would do the things because he didn't have any kind of mobility. He couldn't do anything. I was so scared. And I had to turn to God, and he was the one that pulled me out of that dark hole. I was so scared. All I could think of was my brother. It's like that. I don't want to be like him. I don't want to be where he's at. So sorry.
Nancy is a warrior. She's a fighter. As an MS specialist, I am always in full admiration and in awe when I see a patient like Nancy. She has a very particular story from her family standpoint. Her brother, unfortunately, had a very progressive type of MS and unfortunately passed away. That said, MS is not something that defines Nancy. She defines her own path, with or without MS. It is something that she knows right now how to not overcome, but to live with and to go beyond the challenges that it presents.
Big part of my life is my animals, so I have a big interest in taking care of as many animals as I can and rescuing animals.
Sandra has always had a love for animals. So I met her when she was 8 years old. I was 9 years old. She had 1 dog and 1 cat at that time. That's one of her goals in life for the future, starting a nonprofit to help animals, especially animals that don't have a home. So I know she cares very much about that.
Yeah, I appreciate that I am still able to be mobile, and that at times I've been able to still walk 10 dogs at a time. And it's funny because sometimes, people that are driving by and they'll see me with the 10 dogs in the car, want to take a picture of me with the dogs. And I'm like, yep, that's me with all the dogs. I'm the crazy dog lady. My name is Sandra, and I have multiple sclerosis. So growing up, in a Mexican household with Mexican parents, if you're feeling sick or you have a symptom, you're probably, just worked too hard, or you did, too much housework, or, it'll just take you a few days to recover. Just, take an aspirin and relax.
One of the things with being Latinas in our community is if a disease, a condition is not visible, if we can't see it, then sometimes it's kind of like, hold on, is this real? Are you making it up? Is it all in your head?
Hispanic patients with MS actually have a delay in diagnosis and a delay in treatment, which consequently may increase their disability that they accumulate. If MS is left untreated, the lesions in the brain accumulate, and that can cause more disability. And if they don't have access to the proper treatments, that disability can worsen and eventually affect their ability to walk or think properly or see. So in the past, MS was perceived as a disease of Caucasians or non-Hispanic whites because the prevalence of places like Minnesota or Maine is 240, 250 in 100,000. Same for the Nordic countries. But in reality, we just did not have the studies in Hispanics. Now, it's only been in the last 10 to 15 years that Dr. Liliana Amezcua, who's at USC in Southern California, started the first Hispanic MS registry. And from that, the Alliance for Hispanic MS Research, or ARMS, was created. Those collaborations allow us to understand that MS in the Hispanic population tends to show up 3 years earlier, that they have more disability at the onset, and also that the place of birth and immigration play a role in developing MS.
Well, hello. Good to see you again.
Nice to see you.
It is true that the understanding of what MS is has been very difficult for patients with MS in the Hispanic community. Of course, socioeconomic factors, cultural beliefs can play a role as well. One of the most common misconceptions about MS within the Hispanic community that I have encountered sometimes is that there might be a way to make it go away on its own without treatment.
I think in general, there could be a distrust of the healthcare system, especially in immigrants, or perhaps a lack of insurance that will prevent them from seek help if they develop symptoms.
My mom, she grew up very poor. She actually immigrated to the U.S. from Guatemala. She used to tell me, she's like, any disease you can't see, that those are diseases for rich people. Only rich people have the luxury of having those diseases. Everybody else, all of us have to work. We have to get up and we have to go to work day in, day out. And, anything going on in the background, you don't show that. And that is kind of the mentality that we grew up with as Latinos. You get up, you do your job day in, day out, doesn't matter what's going on.
It is very important to raise that very special education for the patients. So this is where community outreach to raise awareness for MS really plays a very fundamental role in getting the word out about MS as an autoimmune condition, and the person has no control over it when it does occur.
So my first signs of MS were about 15 years ago. I first had some pain in my back. A few months later, I did have blurred vision just in my left eye. Then I went to see it was just my regular practitioner. She right away, I heard her step away for a minute, and she went into her office, and she thought, I guess I couldn't hear, but I could hear her on the phone, and she was calling neurology and discussing my issues, and I heard her. Pretty much I could hear the whole conversation, and she came back to me and let me know that she wanted me to see the neurologist because she was concerned that it might be something more serious like MS.
She got diagnosed in her late 20s. Both of us were just enjoying life, and it was hard. I know she was terrified of what could happen.
it was just, scary. And I can still remember going home to my parents' house when I first got diagnosed and just sitting in my bed from, when I was a kid living at home and just looking at the ceiling and crying to myself because, I didn't know what to expect.
The burden of MS on a family cannot be understated. We can think about logistics, for example, somebody with young children who need childcare, who need attention. You can speak about financial issues as well. It is very difficult and can be very expensive at times to obtain health care in this country.
It wasn't until later that I started realizing more of the cognitive issues with, just memory issues, short-term memory loss, not being able to think on the spot, or not being able to get the right words out, spit out the right words. So, it was just stressful.
I know it's hard for her to sometimes be in conversations and feel like she lost the conversation. But that's one of the things I'm very proud of her, is that now she is more outspoken and saying that she does have MS and not ashamed of it. So I'm very proud of her for that. Pretty much the only rule to the game is you have to grab all of the same color.
Yes, it's definitely important to be proactive because nobody else is going to do the work for you. And so in my case, I'm glad that I was able, that I had the resources and the knowledge to go ahead and start researching doctors and find, who I consider to be one of the best in my area or in my region. That was really important to me, to find a doctor that would understand my culture and understand where I'm coming from.
So there are many different medications that are FDA approved in the United States. The treatment landscape for Hispanics with MS in principle is the same as it is for the general population. However, the reality is that many of our patients with MS who are of Hispanic Latino descent encounter many obstacles, many barriers to access that medication. And that many times includes proper evaluation and the correct diagnosis with MS in a way that is not delayed. And the patient can become very overwhelmed and very discouraged by the process of trying to obtain the medication that many times they very desperately want to be on and to be able to continue.
So I have been very fortunate and blessed. I have been stable for, I would say, almost 10 years now. So it's been great. But mainly, like I said, I have the cognitive issues and fatigue are the main issues. But for the most part, my MRIs have been stable ever since I started this new treatment.
Accepting herself, loving herself, seeing the beauty that she has inside of herself. She doesn't have to do this world alone. So even when she feels alone, there's always somebody there with her. So I know that she has a very close relationship with God, and that she feels supported, that she knows that everything's going to be okay. She doesn't have to do life alone.
The saying I love is si se puede. So anything is possible. Si se puede, with the help of your family and friends and your doctors.
So right now, it's been over 15 years that I've had multiple sclerosis, and my health right now, I feel good. I keep myself up trying to go to the gym. I feel like my health is in a good place. I push myself to try to eat better, but that's really hard. But I'm doing really good with that so far.
Physical activity for Hispanics with MS has a spectrum of disease activity. And a lot has to come down to the accrual of disability, whether or not the patient has a certain level of disability that has already occurred by the time that I get to evaluate them and see exactly what it is that they want to do as one of their goals for physical activity. For those patients who are still ambulating, there is a lot of interventions that can be done: physical therapy, occupational therapy, personal exercise regimes, many things that are available.
Dr. Rivero, I just started seeing him about a year ago, and he's awesome. He has just put me on the right path with the right medication.
There is a lot of hope in MS. And it is real hope. It is not false hope. It is hope based on science and the research that fearlessly is ongoing, not only in this country, but internationally. And so I am extremely encouraged and very, very hopeful about the future of MS. We don't have a cure right now, but there is a fundamental drive, a yearning, a desire to reach that cure. It will happen. It's not a question of if, it's when. And I feel that every year we get a step closer to finding that cure.
Don't ignore neurological symptoms. Be an advocate for yourself. Ask to be referred to a neurologist. You're not alone. We are here for you.
We love to travel. My husband said that for as long as he lives. Once I got diagnosed, he says, I'm going to try to take you to every single beach that you could think of, to every single place. We're going to try to travel, go to places. Just go and travel the world to as many places as we can. He says, I promise you that we're going to do that. And so we have been able to travel the world quite a bit. We've gone to a lot of places, Bahamas, we've gone to Hawaii. We were able to take our kids to Hawaii last year, and that was cool.
Disease, it's a fight, and you gotta get up every day, positive. You wanna pull through, and it's what we learn is never give up.
So it's gonna be okay. Keep your heads up because it's gonna be okay. There's so much hope, and you have your whole life in front of you and ahead of you to live for your family, for your friends, for people that love you. So it's gonna be okay.